Hey everyone, it's Kaitlen Hartig from Group 1, doing the Week 6 discussion board. And this week we were tasked with two questions. And question 1 is: meaningful use has been described with the purpose of creating greater patient engagement. Looking around, it seems that healthcare organizations are meeting the requirements by providing patient portals. This means that each healthcare institution, both hospital and individual providers, will have the independent portals that patients will have access to find information. Similar to how airplane tickets are purchased online and multiple site checking. So we're asked, with your informatics knowledge and as a layperson, what would you want or need from your multiple providers to say that their providing of information has engaged you as a patient? So similarly to our other group members, some things that I would want to be engaged as a patient would be to have my PCP's office move toward the patient portal, allowing access to lab results using things like PIN numbers or email addresses, or even assign email addresses while even inpatient, to communicate with other doctors. I know some institutions do allow patients to set up emails while they are in the hospital to communicate with other family members. I think they're going to start pushing towards expanding that toward physicians as well. Another one would be allowing portal access to patients that would contain their plan of care, because a lot of times, from hearing it from multiple care providers, it can kind of get lost in the shuffle. So I think that'd be something nice for patients to have access to that, along with lab results and a general search engine that provides them with legit sites with backed up medical knowledge, not just like your Yahoo, your Google, which can be misleading information. Also, I think it'd be nice to have an app, maybe if they have updated cell phones, like a Ask a Pharmacist app, I think would be pretty nice. That also allows patients to have access to references as far as their medications, side effects, and things like that. Also, having access to consulting physician information, the services they provide, what hospitals they go to, and any kind of feedback from patients, I think would be helpful, and make the patients feel like they have more autonomy in how they direct their care, I think would also engage them more. So moving on to question 2, meaningful use, stage 3 is likely to include patient-generated data. What should health personnel do with the patient-generated data? So what I understand with this question, I would say give them an online portal to make appointments with physicians, and they could either have the option to make appointments online or have have a hotline that they would call and set up the appointment with the patient. If they don't have easy access to computers, that would be another way to get more involved with the data and the patients. The email addresses I discussed would be, you can assign them to offices and then have them some way filtered to the physician. Emails toward, ask the nurse, or if you're asking for appointments, filter them to the secretary email. Have providers that send prompts through the computer system to emails for annual appointments for patients, reminders for scheduled blood work, sending patients surgical checklists that they can have through these patient portals, I think would increase compliance and help with safety, promote health overall. I think that would help. However, some challenges to this would be, patient compliance. Not everybody has easy access to, electronics. Um, Filtering information, a lot of things can be overwhelming and can end up in one mailbox and be frustrating to sort through. And also, you have to be concerned about patient privacy as well, making sure that information doesn't, get into the wrong hands and the wrong computer. So, these are just some things to think about, and looking forward to any responses or feedback. And I believe that is it for my week 6 discussion. Thank you.